is CBS 2 News.
Could this machine be the answer to your low back pain? I'm Dr. David Marks, and I'll have the story coming up.
Well, it affects a lot of people, but chronic back pain is not something you should have to live with.
Dr. David Marks is here with details of a brand spanking new treatment.
That's right. Now, doctors treat lower back pain with anything from acupuncture to surgery, but there's a new non-invasive treatment that may help some patients. 40-year-old Robert Ruo was an active, healthy New Yorker, but 4 years ago, while walking into a store, his back gave out.
All of a sudden, I literally couldn't walk. I was incapacitated.
He immediately went to see chiropractor Drew DeMann.
I crawled into the back of a taxi, and I came directly here.
Robert had herniated a disc in his lower back. Dr. DeMann thought he was a perfect candidate for a new procedure called VAX-D. When a disc herniates, the soft center bulges out, and this can push on the nerves. The idea behind VAX-D is it pulls apart the spine. This creates a vacuum that draws the disc back into place. Patients lie on a computer-controlled table that applies gentle traction to their spine. And here's the result. This is an MRI of Robert's lower back. You can see the disc protruding. After 4 weeks of VAX-D treatment, there's a marked improvement.
Here's the same patient after treatment. And this is where the disc herniation was. And what we're looking at now is a rather small disc bulge.
Dr. DeMann is one of the few doctors in the area who has the VAX-D machine, and he's seen it work for many patients.
The 4-year follow-ups are excellent. Most patients, about 80%, are still pretty much very close to asymptomatic when we discharge them.
Robert is one of those success stories.
I have an 8-year-old son who's quite active, so I do everything with him from rollerblading, skateboarding, basketball, football.
Some insurance companies cover VAX-D, but so far Medicare is not one of them. If you have to pay out of pocket, it'll cost around $150 a treatment, and you usually need between 10 and 20 treatments, so it's not cheap, but more and more insurances are covering it.
Looks like remarkable results, too.
Great results.
Thanks, Doc.
Okay.